Good afternoon, everyone. It's Dr. McQuillan from Berkshire Menopause Clinic. So one of the common questions I get asked is, they found a fibroid on my ultrasound. What are the treatments? So let's start by just describing what a fibroid is. So a fibroid is a benign, so non-cancerous tissue or mass found within the uterus. So it is within the muscle of the uterine wall. So it can be any one of these multiple layers in the uterus that you can find fibroids. They are 99% or over 99% non-cancerous. So very, very rarely they can be cancerous. Now, these fibroids can absolutely be coincidental finding. Some people get very tiny fibroids, less than a pea. Some people get huge fibroids. And so for that reason, it may get picked up on ultrasound and you have no symptoms. But some other symptoms you may get is really heavy periods. You may get pressure symptoms because of the size of them. So they impact on causing pressure on your bladder, pressure on your bowels, pressure on your tummy, giving you bloating symptoms, making you feel like you're pregnant, giving you symptoms where you get constipation, you're not able to go, or a feeling like something is sitting in your bottom. And then pressing on your bladder. So some people find it difficult to go to the toilet, so they got what we call urinary retention, they're unable to pee, or some people get that pressure on your bladder of constantly needing to pee. So why I'm telling you all of this is the answer is it depends on your symptoms and your quality of life. So because fibroids are not cancerous, you don't need to do anything about them. But depending on your symptoms is whether or not you need treatment. So for example, if you had heavy periods, we might want to treat you for your heavy periods. If you had pressure symptoms, then we want to look at what is the size of those fibroids. Is it worth having a look at treatments that can shrink the fibroids or take them out? But if they're a coincidental finding, you do not need to do anything to them. You do not have to have them taken out. In some circumstances, for example, people trying to get pregnant, if you've had a long time of trying to get pregnant and you've not been able to, and then they found fibroids that are encroaching on the womb lining, this can sometimes make it difficult to get pregnant, and therefore your gynaecologist may discuss that with you. So I really hope this post was helpful, just to say, in summary, that it's about quality of life and about your symptoms with fibroids, because majority of them, over 99%, are non-cancerous, and we don't need to do anything about it. But if you're getting symptoms, then it's important we discuss all the options with you and what you can do about it. Take care.